This hospital is a lifeline for Syrians who can't afford to pay for health care. Yet, it doesn't have the resources to cope with the hundreds of patients who seek treatment every day. We are in the emergency room of the main government hospital in Damascus. Some come from the countryside because many of Syria's health facilities have been damaged by war.
There are no proper hospitals in Ghouta. There is no infrastructure there. It was never rebuilt since the regime recaptured it.
A little over half of Syria's hospitals remain functional, according to the World Health Organization. And there's a chronic shortage of medical staff. Experienced doctors and nurses have left the country. Those here say they can't survive on their earnings, equivalent to $20 a month.
Situation very difficult for us as a doctor, as a nurses, because of how much money we earned as month.
The hospital is also underfunded. Bassam shows us radiology equipment that was here before he was first employed in 1997. A lot of the medical apparatus don't work because there are no spare parts.
We lack basics like gloves, syringes, antiseptics, and of course we lack machinery. We also lack staff because at least 30 to 40% don't show up due to low pay.
This is where people in critical conditions are taken. Doctors here tell us lives have been lost because of the lack of essentials. Muhammad can barely speak, but he insisted on talking to us. He explained how he needs medicine and tests, which are not available here. And he needs money. 90% of the population is poor.
One of the challenges of the new administration in Syria is to continue to provide services to the population as it tries to transition the country from more than half a century of rule under the Assad family. The World Health Organization says this is critical.
It warns this cannot be done without the help of international donors. The new rulers inherited a country in ruins with a shattered infrastructure and destroyed economy.
We have reached the brink. We are under a lot of pressure. We just don't have a budget to upgrade our services.
The images that come out of this hospital show the critical state of Syria's healthcare, where life-saving medicine is a luxury. And this facility is considered to be among the best. This hospital's story is just one example of the scale of human suffering in Syria and the challenges facing its new rulers.